Hi there guys, Nick from In Control Physio here. Today this video is going to be talking about one of the most common areas to injure in football amongst other sports. And we're going to look at how we can prevent that area from getting injured, as well as how we treat it once it does get injured. And the area we're talking about is the groin. Numerous studies out there have it highlighted as one of the most commonly injured areas in football. Actually, before I made this video, I came across 4 or 5 different studies that had it, along with hamstrings, as the most commonly injured area in the professional game, time and time again. There's also been a proven link between reduced adductor muscle strength and increased risk of groin injury. It's something we see all the time in clinic as well. If someone comes in with a groin injury, we're most likely going to see reduced adductor muscle strength there. Despite the fact that it is a common injury, most athletes and casual sports people aren't doing enough to protect against it. So how are we going to protect it or recover it? Well, first let's get a basic level understanding of what it is and what it does.
So if we look here, we can see what makes up the groin area. When we're talking about the groin and injuring it, we're almost always talking about the adductor muscles, which attach along the femur or thigh bone up to the pubis or pubic bone. As you can see, that's adductor brevis, longus and magnus. The one that is primarily strained or torn when injuring the groin is adductor longus. In isolation, these muscles bring the leg towards the middle of the body, known as adduction. But this muscle group doesn't just work to do this movement, of course. Adduction needs to activate in actions such as directional changes, kicking, reaching and jumping. In fact, this is the order of actions in which adductor injury most commonly occurs.
Straining or tearing these is the most common type of groin injury. There are others, of course, such as an inguinal hernia, for example, but we're not going to focus on that today. We're just going to focus on what the majority need to do to affect their situation. Even though it is such a common injury, experts have found that it actually is possible to reduce the likelihood of getting a groin injury just from doing a series of uncomplicated exercises. These are also used to rehab after the injury has appeared as well, so I'm going to take you through the ones I found best success with.
The first exercise we're going to look at is what is known as an isometric exercise. This is great at recruiting the muscles in a controlled way and without moving into painful range. Preventing groin injury, you would likely skip this straight onto the harder exercises. As shown, use a ball or cushion between the knees or feet. Putting out the feet will make the muscles work with a longer lever, so it will be slightly more challenging. Adding an additional up and down movement of the legs will add further challenge. Next is a resistance band exercise, which I find very effective and adaptable, but I'm including as a bonus as I know not everyone will have access to a band and there are still great alternatives without one. This isolates the adduction movement we saw earlier and can be easily progressed by using either different stroke bands or by bringing the legs slightly further past the midline and across the body to continually encourage further adaptation of the muscles. Now, this next set of exercises for me is the big one and arguably the best evidence supported exercise set for rehabbing or preventing groin injury. It's known as the Copenhagen Boy exercises and it has 3 levels. The first shown uses your other leg to resist movement after a small range and is very much the easiest. It can be skipped if you find you can do dozens of them without fatiguing. The second of the 3 is where things start to look quite tricky, but I promise you, even doing a few of these initially is worth it. Put the leg we want to affect up on a chair or comfortable platform with the knee over it. You can alternatively get a partner to hold you up at the knee. Squeeze the legs together with the top leg doing the majority of the work to lift you off the ground. This will likely be at least uncomfortable for anyone to do as the muscles are working hard, but this manageable level of pain or discomfort is safe and usually necessary to go through for the muscles to adapt. Speak to your own medical professional if you are unsure if the amount of pain you experience is okay. Finally, the third progression, adjust position so only the foot is over the chair. Again, this will use a longer lever and be further from the rest of the body, so it will push you that much harder. If you can get used to these exercises, the adductor muscles will adapt to have greater ability to deal with the demands they're placed under, especially in sports, and therefore should be less likely to get injured in future.